Interestingly, Chirlane de Blasio, or Chirlane McCray, I guess is her name, has embraced Project Thrive, which is Mayor de Blasio's, one of his campaigns in part to help enhance mental health treatment, identification and treatment in the city, in the greater city. And Chirlane McCray has, as a sidetrack, embraced maternal depression as one of her issues. In fact, she was kind enough to be taped for our Ask the Question video, and we spliced her in as part of Northwell Health. She was at the opening of the women's track at Zucker Hillside and agreed to be filmed having seen the Ask the Question campaign. Greater New York Hospital Association, in part, I think, because of her interest in maternal depression, has taken on an initiative called the Maternal Depression Screening Collaborative, whereby hospitals in New York State are encouraged to volunteer in this collaborative where they agree to screen for perinatal mood and anxiety disorders. Chirlane McCray and her team have gotten the mayor and others on board, and the New York City hospitals have committed to the public hospitals have committed to screening for maternal depression at the end of 2 years, that all the city hospitals will be screening, but all the entire state hospitals are in this voluntary collaborative, of which Northwell is participating, to collect data about what's the best instrument to use for screening, to collect outcome measures, to say when should we screen at the first postpartum visit, and then when again, should we do it at a pediatrician's office? Is it at the OB's? Because the pediatrician actually sees the woman much more than the OB through the whole first year of life. This collaborative is pretty exciting because great minds are getting together to decide how and when to screen, and then what to do with those results, and then how best to access services. Because once you screen and you find things, you then need to have the appropriate treatment services, which is, I'm part of that subcommittee trying to figure out the treatment services, because we don't have enough psychiatrists who are fully trained in the recognition and treatment of perinatal mood and anxiety disorders. And it is becoming an increasing interest in the residency training programs. I gave grand rounds at Zucker Hillside back in May. I've given grand rounds for the pediatrics department at Lenox Hill, and given grand rounds at a number of places throughout the health system, as more and more people are recognizing that this is an important disorder. So the mayor's wife, being interested, has helped to shine a light on this, as have some recent encouraging articles. The New York Times magazine section in May of 2015 had, the cover story was about perinatal mood disorders. We are not only getting the scary press, which when some tragedy happens, the SWAT teams are called in or whatever, people are all over. We're starting to get good press which is hopeful, and getting people to come and speak about their own experience with perinatal mood and coming out of the closet about it, basically. I think those bad things are relatively rare, because again, imagine nearly 1 in 5 women suffer from a perinatal mood or anxiety disorders, and those, though they're startling, those SWAT team, women throwing babies out of windows kinds of things, are relatively rare. Typically that's a postpartum psychosis, and as I mentioned, it was 1 to 2 out of 1,000 births. And out of that 1 to 2 out of 1,000, a relatively smaller, that have postpartum psychosis, a smaller proportion actually are being driven toward infanticide. If a woman goes to a general psychiatrist, it is a start, as long as that psychiatrist is informed and doesn't, if she's had a pre-existing condition, immediately take her off medication. The problem that has been for many women who have a pre-existing behavioral health condition, which then is a risk factor for having a perinatal mood or anxiety disorder or psychosis, is that their treating psychiatrist is uncomfortable treating a pregnant woman and the potential exposure to the fetus. And their first reaction, uninformed reaction, is to take the woman off medication. Worst thing you can do, because an untreated depression, you're exposing that baby, that developing baby, to untreated maternal illness, which we have found to be far worse than the very small risk of a malformation that may be associated with the medication. In a normal pregnancy, 2 to 4% of women will have something potentially wrong with their baby. That I tell the women I'm treating when I get to a shared decision about medication, So think of a theater with 100 women in it. 2 to 4 of them, just because, will have potentially something wrong with their baby. By taking the medicines that we prescribe, which are the antidepressants and antipsychotics, you may add a smidge, less than maybe 1/4% to that risk. 96 of those women are going to have a healthy, normal baby. The major risk of a malformation is just the ambient being pregnant. Doesn't matter, not taking anything, not doing anything special, it just happens. So yet, the risk of untreated maternal depression or taking the medicines away, 68% of them are going to have a relapse with all the sequelae that goes with untreated depression or anxiety. So while a general psychiatrist, if they're informed, can certainly do it, there's a discomfort even in my profession about treating pregnant and postpartum women, and having a command of the literature, having some understanding of what the latest is about the risks and being able to explain that to a woman so she can make an informed decision is really important. I'm advocating for more and more of the medical school and residency training programs to have a focus on perinatal mood and anxiety disorders, because as I mentioned, it is the most common complication of pregnancy. We should be talking about it and screening for it. The good news is more people the awareness is being raised. There's a spotlight of attention. I think the time is right. There's a confluence of media attention, positive attention. There's a confluence of political wherewithal. There's a confluence of provider awareness and an increasing education base that is allowing people to understand that this is a medical disorder, that it is a treatable medical disorder, and that there are people out there who are specially trained in order to help these women. And with treatment, people do well. The outcomes are terrific. So it's a good time for perinatal mood and anxiety disorders in general.